favorite thing to talk. Oh, yes, and we're going to record this webinar. Thank you, Sabrina, for remembering that. Community Tech Network is a nonprofit based in San Francisco. Our mission is to transform lives through digital literacy. And we were established in 2008. I'm a co-founder. Our work is primarily basic and intermediate level digital literacy training for low-income adults of all ages. But we also create curriculum and offer training for trainers. And our work happens entirely in partnership with nonprofits and government agencies. And the picture of the United States shows all of the states outlined in blue where we have some type of partnership. And the other states are where we have volunteers. So we are national. It's very great to have done this work for so long and now be able to spread it across the country. So I am the executive director and co-founder, Tammy Griffiths of Community Tech Network. And I'd like to pass it on to my co-presenters here to do a short introduction for themselves. Sabrina.
Thank you, Cami. I am Sabrina Tam, and I'm the Senior Program Manager at CTN. And I've joined CTN for 5, long time. And yeah, glad to be here today.
Anna.
Hi, good afternoon. My name is Ana Gomez. I'm the Director of Strategic Partnership at Hamilton Families, and I've been with Hamilton since December 2019.
And Desi.
Hi, everyone. I'm Desiree Tejero. I'm the Workforce Development Coordinator at Hamilton Families, and I've been running the Digital Literacy Program with CTN, so I'm excited to share our experience here today.
Excellent. So our agenda is that we're going to first start with the grant and the application overview. It's a lot of slides with a lot of words, but we'll give a copy of this presentation to you guys later. And then we get to hear directly from Hamilton families and their story about their process of applying, and then some of their suggestions for how to, what they've learned around program delivery. And then we get to end with a heartwarming story of one of their learners. So with that, I'm going to pass it over to Sabrina to talk about the application.
Thank you, Cami. So yes, CPUC, they have a fund to bridge digital divide in unserved and underserved communities. And I'll go over how CPUC defines these communities in a little bit. And this is actually the exact same slide that was shown in the previous webinar, except that I want to point out the orange part here. CPUC increased from 19 millions to 20 millions available for us to apply for broadband adoption account, which provide access, device, and training. There are two more types of accounts that people can apply. Those are more for infrastructure. So our focus will be on the third one here, broadband adoption account. And they have a semi-annual application cycles. Every 6 months, they will review the applications and make a decision with whether to accept or reject. But you can apply, you can submit the application on a rolling basis, but they're just going to review it every 6 months. So the upcoming one is July 1st, 2022, so in a couple of weeks. And then the next one will be in January. So on and so forth until this $20 million is all gone. Okay. So as I mentioned, our focus will be on this broadband adoption account grant. And within this, there are 3 eligible project types. Broadband access, they call it BA projects, call center, CC, and then digital literacy DL projects. Which is for organizations like us and you guys, our partners, to apply to provide digital literacy training and also public education to communities who may not know about internet broadband. It's more like a public education component you can apply for these different types of communities. Early this month, I think June 1st, CPUC just put out this modified application packet. And I compared this to the previous applications. The components are pretty much the same, more or less the same, I would say. If you apply for CPUC grants in the past maybe 2 to 3 years, this should look familiar to you. And CPUC try to simplify the application, and we'll see if these changes are really improvements, and we can give them feedback. But there are 3 components of these applications. The first one, application, which is an Excel workbook, and there's 2 tabs. Tab 1 is the applicant general information. Tab 2 is the project information. In the previous grants, they have multiple, I would say 7 or 8 tabs. So they kind of simplify it in some way. They put a lot of the different tabs information into tab 2. They call it project information right now. So it is a very big tab in tab 2. And then we have the work plan, project work plan, and now they put it out. It used to be part of the workbook, part of the Excel workbook. They put it out and make it a standalone Word document. And there are 2 different work plans. One is ramp up, one is the program implementation. Yeah, so they have the template for it, and we just need to fill it out. And the last component is the different attachments that required. A, cover letter, B, curriculum and outreach materials. And if you partner with CTN to apply for this grant, we can provide you with the curriculum and the outreach materials. They don't have to be the ultimate curriculum that you will use, because we still need to do the needs assessment, but this will be like kind of like a sample curriculum, and our curriculum has been approved or proven to work for this program. So CTN can provide to that, so you can attach it. C is optional, but recommended to provide is the endorsement from community or any letters of support. For example, if you have some residents or some clients who really want digital literacy training, they can write a letter and you can attach it to their application. D is a document to prove that you're IRS nonprofit tax exempt condition. C is the notarized affidavit. They do have a template for that, and you can download these from these application packet links on the right-hand side. I have included these download links for your convenience. These are also available on the CPUC CASF website, but they're all here for your convenience. So in the packet, it will include the Excel workbook, the work plan template, as well as the affidavit template. Okay, and I would also recommend downloading the other 4 documents here, the application instructions. So they have a Word document, provide instructions for the different sections of the application, as well as this is new. The overview is new thing that they do. They provide, it has some pictures of some examples, how to fill out, especially the Excel workbook. So I would recommend downloading that when you're ready to fill out your application. And the FAQ administration manual, I also strongly recommend, even though you're not, we're still in the application process, I would recommend it at administration manual, just because you can see what is expected when you are implementing the program. So then you will know what you need to do, when and how. Then you can really, when you put together the budget, you can plan ahead exactly how much of time that will be needed. And then you will have a more accurate budget. So I think that, yes. Now on the workbook itself, there is the project information tab, if you remember. Some of the key highlights I want to mention, if you're partnering with CTN, on the part where it asks for contractor or vendor information, then you will put Community Tech Network, CTN information there. Project locations. This is different from previous round, because in the past, if you have multiple locations, let's say if your library, you have different branch, and if you're housing developer, you may have different affordable housing, you are required to put one application for each site. Now that has been changed. So if you want to apply for just one project, and then you can list out all the different locations, and you can have classes at its different locations, count as one project. So one reporting, one application, one reporting. So that makes it easier. Also, let's see, community being served and the project locations are two different things. The project locations where the classes will be held, and they just need to be accessible to the community being served. Okay, fourth point, if the applicant has more than one project of the same type. So same type meaning if you're just doing training, so the DL, digital literacy type, and you don't have to have different workbooks. You can still have just one workbook. So one tab. Cami, if you can go back to one slide. Yes, this slide, yeah. So tab 1 is the applicant general information. So you have just one tab 1, and then you can have multiple tabs too for different projects within the same workbook. So yes, that's what I want to explain. So CPUC did try to simplify this. Instead of multiple workbooks, they just want one for the same type of project. Same go with the work plan. If the work plan applies to different locations, different projects, you can just submit one work plan and just make a note to CPUC that this is going to be the same work plan for all. And the newer component also, a modified component is project description, which they want to know a short summary of the project, issues that the project is proposed to address, and how the project will address these issues. So all that goes into the workbook, and these preference checklists also go into the workbook, and you just have to answer yes or no and provide a little bit of details. So this is again how CPUC defined the unserved or underserved communities. And if you check yes to any of these, they will give you a preference. So low income, and they use the CARE income limits. So for utilities as the index where you can find out whether your clients or your residents are low income or not based on these CARE income limits. Low education, limited English. So if your community have a lot of learners that speak that the first language is not English, they will give you a preference. If it is a rural area, if it is a project with community support, endorsement, and or partnerships, if it's a community with some other demonstrated disadvantage, which affects broadband adoption, and lastly, coordinate, if you coordinate with other public purpose programs and funding sources. So all these are, CPUC will give you preference to when you apply, when you review the grant. Okay, budget. There are two big components in this budget. One is the devices, whether it's in class, the devices are going to be used in class, or it's the take-home devices that the learners can take home eventually. And there are some limits in terms of the budget for these devices. We went over this last time, so I'm just going to go over very briefly. Take-home devices, the max is $300 per each, and it is an increase from previous 150. Now it's 300, and the maximum per project is 40,000. And instead of one device per household, it's now 2 devices per household, and how they divide the low income participants. So if you have some clients that are low income and some are not, CPUC will only reimburse for the devices given to those that are. For those that were not, then you would have to pay out of pocket or find another funding sources for those devices. Okay, so then another component of the budget is program implementations. And within that, there are different parts on the budget workbook, and you will see the different parts. The biggest ones are outreach, curriculum, instructions, and there are some others. Oh, administrative also. And they do have a limit of 15% of the budget of this program implementation budget allocated for admin. If you have more, then you have to pay out of pocket. And I think that we all want to try to limit to $477 per participant. And this is excluding the device. So 477 is just for the program implementation. So with the device and the program implementation cost, then we'll get the total program cost. And with this here on the right, trying to do the pie chart to show you up to 85% will be funded by CPUC, and the remaining 15%, you either have to self-fund it or fund in other funding sources. And here it says a note saying that 150,000 is the maximum amount if you want to be going through the expedited review. If you are more than that amount, you will have to go through the full review, which involve all the CPUC commissioners, and it would just be a much longer process. I would put it like that. Okay, and the transportation is up to 10% of the grant amount. So these are the limitations of the budget. Okay, there on the worksheet, there are some formulas already set on the spreadsheet. So you just need to plug in the unit price, the quantity, and then the total cost will be calculated automatically. But they did not lock these cells. So there's a chance that you may delete, these formulas, and that's okay. You can either add it back, or if you have questions about, this spreadsheet, you're more than welcome. I will work with you. So also the grant request amount, how much you want to request, you need to enter that, and then the match funding will be calculated. So just pay attention to these formulas. This part of the spreadsheet on the budget sheet is locked. You cannot make any changes to it. So you may try to, enter numbers in here, but you don't have to. They're locked. You cannot actually, and this will be populated based on what you entered above this spreadsheet. So they already put in the formula to calculate how much is your administrative budget is, how much percent, and how much match that you're going to provide for this. So just pay attention to this part of the spreadsheet. You're not going to be able to make changes, but it would help you to check if you meet the requirements. Okay, and then these work plans, these are Word document that when you download the packet, you will see these as a Word document. And the two work plans, one for ramp up, one for implementations. And they have listed some major milestones, but these milestones are just for examples. Each project may be different, and you can add or you can change these milestones, but these are there just for your reference or examples. And we have the verbiage of all these milestone descriptions and deliverables. So if needed, we can help you to kind of fill these out. And then the start date and the end date, they say dates, but they don't really need the date. They just need to be, they just need to want to know the month number. So when they approve the program, you have 6 months to ramp up or to prepare the program launch. So you just have to say month 1 of the planning period or month 2 of the planning period. That's all they need for here. Okay, and as I mentioned before, they have this expedited review, or you need to go through the full review. If you meet all these criteria listed here, you will be able to go through just the expedited review, which takes maybe 3-4 months. So that's what we want to go through is this expedited review, so we can get the grant approved sooner. So applicant requests a grant of $150,000 or less. nonprofit organizations that existed for more than 1 year. And if you have at least 1 year of experience doing similar program, digital literacy program, or at least complete at least one of these digital literacy training program or broadband access project. If you already have designated in-person or a virtual space for the training, and if the proposed project cost is less than or is at most $477 per participant, then you will be able to go through this expedited review, and of course meet all those other requirements within the application. So we strongly recommend that when you plan the program, try to stay under these numbers. So project timeline. So CPUC just put out the application packet June 1st, and the deadline to submit the application is July 1st, which is just 2 weeks away. But I did hear from our contact at CPUC that they will be able to give us some wiggle room with the application. So you still need to submit the application by July 1st. But if it is incomplete, they're willing to work with us to complete any missing part. So that is helpful. So once you submit and the application, maybe by Q4 2022, we'll hear from CPUC whether your application is accepted or not. In between, if they have questions and if you're missing some documents, they, as I said, they will still try to work with us and let us submit the missing documents. So, but if we hear from them around Q4 2022, that this program is accepted, then we have 6 months to prepare the program launch. And then we have 2 years for the program to do the training. And then we have the different report timeline and then the invoices timeline, which is it's laid out on here in the time on the slide for you to see.
Did you try the
That's it.
I saw her in there a little while ago.
All right, well, great. Thank you, Sabrina. So again, we know that was a lot of content. We're going to provide the slides afterwards. So now we get to hear from our special guests who are our partners and we love them. It just gives us a chance to help more people. So I want to start off by asking Anna to tell us a little bit about Hamilton Families.
Yeah, thank you. Thanks, Sabrina, for that great summary. It reminds me of when we applied. Hamilton Families is a San Francisco-based nonprofit organization that serves unhoused families. So that is at least one adult and one child. And it's most commonly led by a young, low-income, BIPOC, single mother. We have 3 different programs. 2 are residential. It's our temporary shelter and our transitional housing. And our larger program, rapid rehousing. We provide case management and children's services at our residential programs. And at our rapid rehousing, we offer housing search, allocation, case management, and rental subsidy for about 18 months. And here you have a little bit of the data of how many families we've served in the last year.
Great, so let's dive into it. How does this type of work fit into the other work that you do?
Yeah, I mean, it was pretty easy for us to identify that digital literacy was a priority since we learned that more and more families could have further access to opportunities if they had the tools to navigate and contribute to the internet, anything from accessing their benefits, applying to jobs, being involved in their children's education, and it all provided, encouraged independence and long-term stability. And at our residential programs, it was pretty seamless integration because we already had an existing infrastructure to provide workshops. So using digital literacy was just another workshop that became a placeholder among all the other workshops that we offer there.
Great. And then the application process, we know it's slightly different now than it was before, but just tell us what your process was back then when you applied.
Yeah, Sabrina mentioned there's only 2 tabs, and I was looking back and we had 5 tabs that we went through. And it was in very close collaboration with CTN. CTN, you all have a lot of knowledge about how this grant works and the flexibilities around the work plan. And you kind of give us the reins on the population that we want to target, the class setup that we want to do, and then any milestones. We learned about the grant similar to around this example. So we learned in early December, there was a December 31st deadline, and we chose to apply in July of 2020. I started working towards the application around, I had already done research in December, but then in the new calendar year, we took about a month to decide if it was a good fit, how many number of families we wanted to serve, what additional resources we needed to allocate internally to make this possible. And yeah, we hit submit for the July 1st deadline.
Isn't it fun to think back how much has changed since then, and what you were to put in there, and we'll talk about COVID in a second, but some of the hurdles in completing the application.
Yeah, well, we did, as pointed out here, internally communicate the purpose and what resources needed to be allocated internally. We quickly learned that there is an investment outside of that 15% self-funding. There is an actual work investment that we needed to make sure that we allocated ahead of time. And then also, I've never done digital literacy. Hamilton families had never done digital literacy. So it took me a moment to understand how the structure of the classrooms happened, the work plan, like that took me a little bit, as well as navigating where to purchase the devices once that was granted. But in completing the application, there were some nights that I was just on the worksheet late because I wanted to actually understand what I was committing to during the application process.
Yeah, that's really smart. So what did you find to be the most time-consuming aspects?
Yeah, definitely the work plan. There's a lot of detail that they ask about every task, every milestone, not only details, but when you're going to complete it by, what's going to be your methodology. And CTN is very knowledgeable, and you were all very patient with us because you gave us the tools and we had to understand what they were and how to apply them. The project description also was very, very detailed. Anything from outreach, how we're going to set up the classroom, how many people we want to do in each cohort. Do we want to do 8 hours in one day? Do we want to do 2-hour classes? Like there was a lot of way to tailor it, but it was also hard for me to decide for something that I didn't know how it was actually going to look when we applied it. So that was a little bit of time consuming. And then, yeah, all the attachments, putting together the curriculum. Again, I was like, I don't know, but CTN, you were all very knowledgeable and shared that with us. So yeah, I would say those were the consuming parts.
So now, knowing what you know, what would you do differently?
Yeah, jokingly, I would say get rid of COVID. COVID provided a lot of obstacles for a plan that kind of deviated, like COVID made us deviate from our work plan hugely, I would say. But we did apply for all of our 3 programs separately. I would do differently. I would combine the residential application. Instead of doing 1 per site, we would join the 2 residential ones, and setting a realistic number of participants. Again, COVID made it difficult for us to meet our goal, and we confidently thought that we were going to be able to serve the maximum number of participants, but we realize that's really difficult in the time of COVID. So if there's, I'm not saying like there's might be another pandemic, but at least considering realistically how many people come in your community or to your place of business, and kind of tying it to the application process.
Because if you don't hit your numbers, there's a consequence, right? They won't reimburse you fully.
Right.
And they will give you an extension time-wise, but not any more funding.
Right. So if we want to continue offering classes, we would have to fund the 100% of the additional classes. So in our application, we outlined that we would do 7 cohorts in the 2 years. And our idea was to serve about 10 people per cohort. Well, one of our programs not doing as closely enough to that. So the option is we can give you more time to fulfill it. But that means that we will do all 7 cohorts, and then year 3 comes, we still have to put our own money towards the instruction and the devices outside of what was outlined because we didn't meet that goal.
Yeah. So what advice would you give for folks who are considering to apply?
Yeah, I mean, I'm gonna kind of read off this bullet here. Set very clear expectations on the program and leadership. This for us, we learned that this is a collaborative effort. So outreach has to be done at many different levels, and engagement has to happen simultaneously. Be strategic and mindful about the numbers of clients that you can serve. Just to my previous point about how many people are actually coming through your doors. Understanding the limitations of the grant. Sabrina, you outlined that very well for us. For me, like I really wanted to be careful about how much we spent towards the device. So when we applied the devices, we only received $150 per device. So shopping with that in mind was very limited. And then again, be clear what support is needed. CTN has been extremely great with us as we have been implementing the classes. But there's also a lot of internal support that is needed because our case managers have those relationships. They know better about what our participants need. So being clear that we need support when it comes to engagement.
Excellent. Well, thank you so much for that. Now we're going to jump into, they applied for the grant. Yay, they got the grant. Now they're delivering the grant. So what are some of the things that they would suggest to you all when it comes to actually delivering the program? So are there suggestions that you could give folks? Like what are some suggestions for program delivery? So Daisy?
Yeah. So yeah, after we are in our fifth cohort right now. So we've learned a lot from the first cohort. One of the biggest thing is like trying to condense the classes. So CTN is very flexible on like how many times per week to meet with the participants and to provide classes. I recommend doing twice a week because that would mean that in 2 weeks the classes would be over and it really keeps participants engaged, right? So if you do like a longer cohort, maybe people drop out in the middle and we don't want that to happen. So I really recommend that, like just condensing them. Another thing is like the time that passes between the outreach, the signups, and the actual instruction. So I would make that time 2 weeks or 3 weeks max. So in that way, you keep participants engaged. They don't forget about it. They don't forget they signed up for this opportunity because it does take a lot of work, like organizing and coordinating and managing the not just the instructions, but like the whole process of like signups and engagement and all of that. So just trying to like do it very short, trying not to wait much for that. We initially did for the first cohort a needs assessment and a survey with a bunch of questions like regarding the curriculum, regarding scheduling and all of that. And that, that meant that it took a while for people to get those forms back to us and for us to actually like schedule the classes and just like plan it. So what we decided is to like have a set schedule that we think works best with the families, working alongside with case managers. They know more or less the schedule of families, like when children go to school, when they go to work, and like just providing, a schedule and like a curriculum that can be, from beginner to intermediate. So that way it's like flexible and the instructors can adapt it a little bit during the classes. And in that way, it's like a shorter wait time between signups and like the start of the classes. We have worked in two different ways. So we've done online cohorts and in-person cohorts. So it is important to keep participants engaged. For the online cohorts, the remote learners, we give them the laptop first, like probably 3 days before the class starts. So that way they know, oh, in 3 days, I'm starting the class, and they don't have the laptop for like a while and then they forget about it, right? So we try to do that to keep them engaged. Also super important, I think Anna talked about, is like saturating in programs and in your organization at all levels, the program expectations of this grant and of this program and the support that you need. And just being very explicit around that just to get that support. Yeah.
Great. So now let's talk about outreach, which is really, really hard to get to the people who need it the most. So tell us some things that work for you guys.
Yeah, so it's important to do different kinds of outreach depending on the population that you're working on and the programs, right? So for our remote learners, we have done like mass communication emails, attaching like a sign up or Outlook form for people to sign up or to show interest through that Outlook form. So I don't know, maybe I would send out an email to 100 people and I would get 15 responses, which is a big number, like a good number to already have a class, right? So like I really recommend like outreaching to like a higher number of participants. If you get like a lot of interest, you can always add them to a wait list for the next cohort, since the instruction is for 2 years. So this is one of the strategies. Then for our residential programs, we got support from frontline staff, so case managers. So I created flyers, they were hung up in the walls, and then they also did targeted outreach. So talk directly to participants who are like either looking for employment and need a computer to like create a resume, or are studying, or they've never had a like experience like with a computer. So just doing that kind of like targeted outreach. I know other organizations have used interns to help with the outreach because it is lengthy, it does take a little bit of time. And also a lot of participants ask me when I do the outreach, like, oh, are we going to get a certificate? So that's something that really engages them and interests them, apart from the laptop, like you would think that, oh, getting a laptop is enough. Yes, it's super appealing. And that certificate is also very appealing more so for participants who are looking for employment and want to add it to their resume. But I would say mass communication is the one that's has been most successful for us, for sure.
We're going to talk about some of the challenges. So now that you're in the thick of it, what should folks be thinking about that might be a problem later on?
Yeah, so for us, like Anna said, COVID has been the hugest challenge, because our plan was to do in-person classes for our 3 programs. So not having that option, and also the limitations in the residential programs because of COVID, like not having new intakes and new participants coming in, has really affected the number of signups and graduates. So that makes it a challenge to achieve the grand goal. But that was, COVID is better now. Hopefully it'll keep, getting better. So I don't think that will be a big challenge for you guys. Another challenge that I don't think you'll have is finding affordable devices with $150. I know now they have doubled the funds, which is amazing. So you can get a pretty nice Chromebook with $300, which is the device that we've been buying. Another challenge, again, was having that internal support in our organization to collaborate running this program. There's a lot of priorities, a lot of different things. So that's why it's very important to set up clear expectations and ask for support while you're doing the application. We also have been challenges getting the devices to people, and this is again because of COVID as well. We have a lot of participants spread around the East Bay, so not just San Francisco. So they can be as far as Sacramento. So just having those devices delivered to them has been a challenge. Also, having a childcare plan for learners, it's not as like a big challenge for those participants who are remote and they're doing it from home. It's actually very convenient for them. For our residential programs, it has been a little challenging sometimes. We do have a children's services program, but they have their own like requirements and their own rules. So it's been a little challenging making that happen, but we're doing it. So that's good. There are some families who don't have internet access in their homes. So it's important to add that question when you're doing the outreach and like they're filling up their application, or like this, they're signing up for the classes, to ask that and to like tackle that early on, just to make sure, you know, like some of them connect with a hotspot in their phone, and that has been okay, you know, but also like informing them about the ACP program or internet essentials, all of that. Again, like keeping people engaged, you know, making it engaging, managing participants not dropping out of class. So that's, you know, there's a lot of, with the population that we serve, there's a lot of challenges they go through and a lot of competing priorities. So keeping people engaged and just like reminding them, you know, they're going to keep that computer for themselves. It's for free. They can use it for so many things after the class. So another challenge has been like retrieving computers for participants who have not graduated. We haven't seen that a lot, but a few cases of that. So it is tough to have to take a computer away from like a low-income family, right? Because we know it's a great tool for them. So we always try to give second chances. CTN has been amazing in like letting participants submit homework and, you know, supporting on that. And yeah, that would be in a nutshell. Mm-hmm.
So lastly, we know that you participate and you finish and you keep the laptop and you get the certificate, but that's not always enough. So what are some other factors that stop people from signing up?
Yeah, so sometimes there's people work during the hours of instruction, and there's so many different schedules that we cannot like make it available for everyone. So that's one of the challenges. Then mental health has been a big one. There's people who sign up, they're so excited, and something happens in their families, you know, and like they just can't, you know, can keep up with the classes. Other times people might be a little like intimidated of like, you know, touching a computer or like, you know, being in contact with a computer because it's their first time ever. So I think that's why like having that contact with people when you're dropping off the laptop or delivering the laptop, just like taking your time to show them like, this is how you turn it on, you know, this is how, here you have like a handouts that can help you, like guide you to like turn on the computer and put your password, things like that, just like to make them feel more comfortable with that. Some other families, you know, they have children's babies, more so when they're like really small, that can be tough for them to like join the classes. People have other priorities as well that come up on the way. They're looking for jobs, they have an interview and they miss that class, you know, things like that. And sometimes they forget about it. So that's like, you know, I see there's a question, how many total hours? Yeah, so it's compulsory for people to have 8 hours of training. It doesn't mean that it's 8 classes. We have combined them online. We're doing 5 classes, so 1.5 hours each class, and that's completed in 2.5 weeks, which is super fast. And then for the in-person classes, we do 2-hour lessons. So in a week, in 4 lessons, you're done with the program. So this is super appealing for participants as well, because they see that they can learn a lot of the basics and intermediates of computer, and also keeping a computer in as short as 2 weeks. Yeah.
Great. So we're going to pause for questions just a second. We have one last story we'd like to share. So if you could tell us a little bit about Enil.
Yeah, so I wanted to share with you guys an amazing success story of one of our participants joining the CTN cohort. So here's Enil. He was at our shelter, and he I'm lying. He was not on our shelter. He was on our like stability program. So he was looking for housing. And then he was really interested in coding. So he really needed a computer for that. So he was more tech savvy than other participants. So he joined, he completed the classes. Also, what's very, I think like very amazing, he brought in his cousin to the classes. So his cousin was in our shelter. So we had like same families, the same family in two different programs of Hamilton families. So he brought in his cousin. He also joined and completed the cohort. And then after finishing the training, since he was very engaged and really wanted to like keep learning, we referred him to a coding program with a nonprofit in San Francisco. He just graduated for that boot camp, and he sent us his graduation. I believe he joined the classes with the computer that was provided for the classes with the grant. And he's looking for jobs in coding. I heard that he probably got a job already in the coding industry, which is amazing. So this is this makes it all worth it, to be honest. Even if you have like one success story per cohort, it's just, it really keeps you going, and you really see like the value of this grant and the value of these classes. There's more success stories, but I think this one is like really special because you see the process from like taking classes, graduating, taking further education, and then obtaining employment. And that's our goal in our program. So yeah.
Absolutely.
Yeah. Mm-hmm.
Thank you for all of that. We're going to start some questions and answers, and I'm going to attempt to read some of the questions that were listed here. And then Carrie, if you want to point out ones that I missed. So question has to do with, sorry, I'm not good at this. Do the clients have to take a test to confirm their knowledge of curriculum topics?
The answer is no. They don't have to take any tests to confirm the knowledge, but it's optional. You can do it. But a lot of time, our client base will feel too nervous. This may defer them to sign up for classes if there's a test. So oftentimes we don't.
Okay, great.
Sorry, I'm going to just interject that for each unit, they do have to do certain activities. They have to complete activities, which aren't exactly a test, but it does show their proficiency. And for example, they have to fill out an online form. They have to send an email. They have to take a picture and upload it. So they have activities that they do all the way through to show that they're mastering the subject. Because as Sabrina mentioned, the communities that we work with, the idea of a test is very overwhelming and can prevent them from learning because they'll have so much anxiety about that.
Yeah.
Right. Yeah.
A question. Go ahead.
A lot of in-class activities, including sending an email, like looking up something and copy a link and paste it in the email and send it to you, send it to the instructor. So those kind of activities that confirms that they do learn, but it's not a real like a formal or official test.
Mm-hmm. So another question has to do with reimbursement. Is it 100% reimbursable, or are any funds expended in advance? So maybe talk a little bit about what's spent during the ramp up and how payment happens. I mean, it's not 100% reimbursable because it's 85%, right? 15% they have to find funding. You wouldn't expend any money in advance. I wouldn't presume. You would wait until you're signed the contract and you're in your ramp up and you know what you can spend the funds on that you can then get reimbursed for. Is that correct, Sabrina?
Yeah, so it is a reimbursable grant, meaning you have to spend the money first, and then you have 3 opportunities to get reimbursed. One time is after the 6 months ramp up period. You can submit the ramp up report and then request for reimbursement for what you have spent during the ramp up period. And then a second time is after year 1 of training. So you submit a report, you also request for reimbursement for the 1 year of training. And then lastly is the year 2 or completion report, then you get the reimbursed for the second year of training. And 85%, only 85% is reimbursable. So one big difference from this new round, for this new round, is that you don't have to we don't have to be reimbursed for just 85% of each line item, or you don't have to match 15% for each line items. You can look at it as an entire program, and so you can get 100% reimbursed for the devices as long as you have maybe your staff time or some other part of the budget as a match to 15%. Does it make sense?
I think so. And folks can follow up. We're going to get to like the next steps in a couple minutes. One more question, maybe there's more. The $150,000 max is for the 2-year period, correct?
Yes, it is.
Okay. And moving on down.
There was one more question from
Okay.
Linda.
And I don't think there are any more questions. Which one?
There's one more question. CTN's curriculum standardized by specific audience, such as seniors versus children and low-income families, or is it customized to meet each organization's needs?
You know, it's so
Yes.
funny. Oh,
That's a
go ahead.
good question.
Yes.
Mhm. Yeah. The short answer is yes. We do customize our curriculum. So we have worked with seniors. We have worked with families. We also have a curriculum for youth, transitional youth, but we haven't worked with children. Transitional youth is like 18 to 24 years old.
And also we customize our curriculum for the partners because everybody orders different devices.
Yes.
So there are different apps on the devices and different things preloaded depending on your community.
Exactly. And also when we do the needs assessment, we have questions asking like what they want to learn, what your communities want to learn, and we will try to accommodate.
Great.
And the final question is intermediate training allowed or just basics?
Intermediate is allowed. So I specifically asked this question to CPUC, like for participants, for partners who have been offering these basic classes before, can they reapply and provide intermediate classes? And they said yes. However, the participant, if they have already received a device from CPUC funding, they won't be eligible for a second device. But the classes itself, the content can be either basics or intermediate. Yeah, there's no limit.
Did you get the question about the 150,000 max is used over a period of 2 years? Okay.
Yeah.
Answer to that is yes.
So we had a question for you guys. I'd love to see a show of hands. I think that's possible in this tool, right? To if you are seriously considering applying now or in the next round. That's something you guys, we're just kind of curious where people are at in their decision making. I hope we haven't scared
Oh,
anybody.
look at all these digital equity advocates. Everybody wants to be online.
Fantastic. So we have just a few minutes left, and if there are no more questions, there's one more slide here that Sabrina is going to speak to.
Right. So next steps. For new partners, meaning you have not worked with CTM before, we would like you to fill out this work with us form. And I think that if we haven't yet, we will post a link on the chat also, where you can find this work with us form. You can also find it from our website, communitytechnetwork.org, work with the form. So if you're existing partners, we are offering application clinic appointment with individuals. So we have these slots open Wednesday. So next week, next Wednesday and Thursday, you can sign up for this 1 hour time slot. And we can also post a link on the chat. And I think we'll share this presentation, right, Kemi? They can.
Yes,
Yeah,
in the
it's-
follow-up message that will go out through Eventbrite, we'll have a PDF attachment of the PowerPoint.
Mhm. And if these 2 days doesn't work for your schedule, and if you still want to try to, meet the July 1st deadline, by all means, let us know, email us, and we would, try to meet with you and discuss what we can do to help.
And Carrie, are you sending a link to the sign up? In the chat, I can as well. Oh, the power of the copying and pasting. Here we go. I think so in our staff meeting. So I'll be wrapping it up in just a second. I wanted to share this because it's a funny thing. We do these mission moments at our staff meetings, which was Carrie's idea, which is brilliant. And somebody shared how they taught somebody how to copy and paste, which, we take it for granted now that we are masters of copying and pasting. And it just, was that you, Sabrina, that shared that story?
Not
was
me,
Steph.
not me.
It was
Oh, it
Steph.
was- and it was just like, of course, it's like, if you didn't know how to copy and paste, you're literally typing something in from a printout. And so, yes, this is why we do our jobs, so that you can copy and paste and get your telehealth and all sorts of other great reasons. So with that, I want to thank our presenters from Hamilton Families and thank everybody for joining us, and for the CTN staff. Please let us know if we can help you in any way. Don't feel pressured to apply now. There will be money for the next round and probably the next round after that. So let us know if we can help. Thanks so much. And good luck with your applications, and we will see you real soon. Take care, everybody.